ഹായ്. ഇപ്പോൾ നമ്മൾ സൈക്കോസോഷ്യൽ ഇൻറ്റഗ്രേറ്റഡ് എൻക്ലക്സ് ക്വസ്റ്റ്യനാണ് നോക്കാൻ പോകുന്നത്. ദ ഫസ്റ്റ് ക്വസ്റ്റ്യൻ: ദ നഴ്സ് കെയർസ് ഫോർ ആൻ എൽഡർലി ക്ലയൻറ്റ് ഹു അപ്പിയേഴ്സ് ഫുള്ളി അലേർട്ട് ആൻഡ് ഓറിയൻറ്റഡ്. As it gets later in the day, the nurse notices the client becoming increasingly confused and agitated. It would be most appropriate for the nurse to take which of the following action? An elderly client in the afternoon and the evening is becoming more agitated. So there are some actions the nurse can do. So we have to choose the most appropriate, okay? Appropriate for the nurse to take which of the following action now. First is reorient the client and then turn on the lights and the television to distract the client from his confusion. If an elderly client is already confused and agitated, do you think turning the television and the light on will help? No, it's a big no, okay? That will make that person more agitated. So option number first, off. Second, encourage the client's alert roommate to talk with the client. Client already agitated and confused, and you are encouraging that roommate to talk with. Is going to do that? No, he's not going to cooperate, or he's not going to talk to the roommate. So second option also off. Third, tell the client he is at home in his own bed to get him to settle down and go to sleep. This is lie, because this patient is in the hospital or care setup, is not in home. So there is no point in lying to that patient. Though he is confused or agitated, don't lie. You have to tell the patient the truth. So option number 4 is the correct option. Reorient the client, pull the shades down, shut the light and television off, and promote a quiet environment. That's what the nurse has to do. So reorient, tell the patient you are in such and such place in this room. So shut off the lights, shut off the television, give a calm and quiet environment, so that promote or decrease agitation and let the patient sleep. Question number 2. On the evening shift, the nurse is caring for a client who will be undergoing a mastectomy. In the morning, a call from the front desk alerts the nurse that the client's family has arrived. It would be most appropriate for the nurse to take which of the following action? Here also there are many actions the nurse can do, but the most appropriate you are looking for, okay? So the first option is tell the family that they can't come in because visiting hours are over. Do you think blocking the family visiting the patient is going to help? We have to look what is the best interest for the patient, best beneficial for the patient. So of course this will be more calming and helping for the patient. So first option is off, okay? So we have to let the even if it's a hospital policy or the care setup policy that visiting hours is over, still coming morning, next morning the patient is going for surgery, the visit, the relatives visit will help this patient to calm or talk, ventilate, okay? Option number 2, tell the client you want to make sure she has some alone time to relax. So a patient, of course, it's normal to be a little anxious when relaxed, but she may require alone time, but that is not priority you are considering here. Of course the patient will get alone time, but that will be what is that, visit from his family will be more beneficial for this patient. Option number 3, invite the family in to offer support after confirming with the client. You ask the patient whether she want to see or he want to see his relatives. Get consent from the patient and let them come in and talk to or visit him or visit her. That is correct option. Third, tell the nursing assistive personnel to sit with the client who needs company. So that is not also a correct thing. So what the family can do, a nursing assistant can't do. Family is family, so that is not the correct option too. If you want to see the family, want to talk, you have to give an opportunity to happen that, okay? Okay, question number 3. The nurse is caring for a young man who has expressed his desire to commit suicide. So he has informed the nurse of plan to pursue this. The nurse requests a sitter to stay with the client around clock. But the client says he doesn't want this. Which of the following is the most appropriate response by the nurse? So a patient who is telling that I decided to suicide and he's planning to do that. So what is the priority here is the safety of the patient. The action also should be most appropriate action by the nurse should be uh, concerning should be about the safety of the patient. So let's see what all the action is mentioned here. First option is nurse allows the young man to refuse because clients do have a right to refuse care. Do you think that this patient has a right to refuse care by risking his life? Now, which one we will consider? We will consider the safety of the patient. We don't consider here the refusal. Yeah, refusal is valid when everything is okay. The patient can refuse the care, but here it's at the risk of his life. So you don't have to care about that refusal. The nurse implements the intervention because protecting the client's safety trumps the client's right to refuse care. Yes, weightage here is the safety of the patient. So the refusal comes later. Okay, so you have to protect the patient. The nurse implements the intervention because protecting the client's safety trumps the client's right to refuse care. Option number 3, the nurse checks on the client every hour to be sure he is safe. So every hour is too much, that is too much lag. The patient can suicide within minutes, can lose that patient within minutes, because 1 hour checking, maybe patient already died when you go and see. Suicide as might have happened already. So then fourth option is the nursing asks the nursing assistant personnel to check on the client every 30 minutes to be sure he's safe. That also not, but that is the duration is too long. There should be somebody at the patient room place where the patient is living continuously, because even 5 minutes is enough for him to take his life off. Okay, so the intervention should be protecting the client safety. So somebody has to be with the patient all the time. Question number 4. A client is scheduled to have surgery the following day. The client tells the nurse, I am very scared. I have never had surgery before and am afraid that I might not make it through. Which of the following response by the nurse is the most appropriate? A patient is next day, she has surgery and she is so scared and she said she may not survive after the surgery. So let's see what is the most appropriate response at this point from a nurse. Okay, why do you feel this way? So that first option. Second is don't worry, you will be fine. That is a false reassurance. Okay, third is why don't we take some time to explore why you feel this way? So do you think that nurse is a therapist, she will try to explore the patient feeling? And no, that she can give nursing care. Okay, she can listen, but uh, understand exploring the patient feelings can be done by a therapist, not by a nurse. Okay, so that is not an applicable here. And fourth, it's completely normal to be scared, you will be taken care of, tell me how you are feeling. So you are reassuring the patient. Okay, it is normal, you feel scared, that is normal. And if that you are what is that, your concern or fear should be taken care of. And it just, if you would like to share your feelings or your what you want to talk to me, or some question, something you want to ask to take away your fear, something you want to share, yes, she can share and she can talk to the patient. That is a correct option. It is completely normal to be scared, you will be taken care of, tell me how you are feeling. So that will be the most appropriate response from the nursing side. Question number 5. The nurse is working on a pediatric unit. The client is a 13-month-old child diagnosed with failure to thrive. The parent reports that the child cries frequently, does not like to be held, and will not eat. The nurse learns that the child's uncle lives in the house with the family when the uncle visits in the hospital. The nurse notices the child acting differently and turning away from the uncle. Sometimes the child's heart rate increases when the uncle is present. The nurse should take which of the following actions first? A 13-month-old child failure to thrive and behaving differently when and the uncle visit him, who stays in the same house. So the baby is turning away from him, and his heart rate goes higher, all those things. Okay, so in this scenario, what a nurse first following what are the actions the nurse can do if the babies behave like that? So first option is immediately report the possible situation of abuse to the authorities. Second, call the physician who will probably have more long term knowledge. Third, discuss it with other nurses to see which approaches they have taken. Fourth, encourage the team encourage the team that is caring for the client to have a family meeting, including the parents, but not the uncle, to gather more information. So that option is a correct one. Option number 4, encouraging the team that is caring for the client to have a family meeting, including the parents but not the uncle, to gather more information. So you don't have to immediately report about the abuse, that is to the first authority. You should have more information. Second option is you can consult a physician but later on, not immediately. And option number 3 is discuss it with the other nurses. Now the nurses is not in the circle of care. You don't have to discuss with the other nurses what they have done, maybe similar other cases. You don't have to discuss with the others who is not in the circle of care. Question number 6. The nurse learns that the client's sibling has passed away during his hospitalization, and the client is distraught by this news. Which of the following should the nurse do first? So, a patient's sibling passed and is hospitalized when he is disturbed while listening this news. What the nurse can do by in the first response, how the nurse has to do. First option is allow the client an opportunity to verbalize feelings and inquire if the client would like to be visited by social services, chaplaincy, or psychiatrists for support. Option number 2, provide alone time by not going into the client's room unless absolutely necessary. Option number 3, call psychiatry services to arrange for them to see the client as soon as possible. Fourth is find out which religion the client practices by viewing the chart and then request a chaplain from religion to see the client. The option correct is allow the client an opportunity to verbalize the feeling. Go and talk with the patient and let he or she have time to verbalize his feelings. Stand beside him, give him a face tissue to just comfort, and ask him once he settled, ask him whether he need any help, like inquire if the client would like to be visited by social services or chaplaincy or psychiatric for support. Okay, that is the correct approach. Other things are not correct, like leaving the patient alone. No, you need support at this point. Psychiatry, that is not an immediate urgent at this point, or find out which religion. These are things all not the priority. Staying with the patient, going and asking, verbalizing the feeling, and inquire from the patient whether he needed help. That is the option there, correct. The question number 7. The nurse is working on a busy locked psychiatric unit. The alarm gets tripped when somebody tries to go through the locked doors without permission from the front desk. Which of the following actions should the nurse take after the alarm is tripped? So in a locked psychiatric room, somebody escaped, okay, and the lock then tripped. So what the nurse will do? Reset the alarm from the front desk after verifying that everybody is safe and nobody has escaped from the unit. Second option is reset the alarm from the location where the alarm was tripped after verifying that everybody is safe and nobody has escaped from the unit. Option number 3, reset the alarm from the client's room after doing a quick scan of the hallway. Fourth, reset the alarm from the front desk once the receptionist says everybody is accounted for. So, resetting alarm is important, but before resetting the alarm, what she has to do? She should make sure that everybody is safe and everybody is in. Okay, the rationale here is resetting alarm from the front desk is not proper procedure. So what she has to do is, second option correct, an alarm is a safety mechanism meant to alert staff to somebody at risk attempting to leave. When an alarm is activated, the nurse should first make sure that all clients are accounted for and safe, and then reset the alarm by going to the place where it was tripped, not from where it was tripped. It has to be set, not from the front desk. Okay, so make sure everybody is making other staff, there is alarm going on because some alarm is activated. The nurse first to make sure that all clients are everybody's head count is taken and they are all safe, and other staff also alert is alerting all other staff to, then everybody is safe, everybody is in, then go to the tripped area, then reset the alarm. The nurse must be sure based on the first first hand knowledge that all clients are safe. Resetting the alarm without doing so would not be appropriate. Okay, question number 8. The nurse is a nurse. The client is an intoxicated male on the medical surgical unit who attempt to get out of bed every few minutes. He is unsteady on his feet, and the nurse is concerned that he will fall if he does get out of bed. The doctor writes an order for the nurse to place wrist restraints to maintain the client's safety and prevent him from falling. The man refuses to restraints. The nurse should take which of the following actions? So the patient refuses for restraints and he is drunk and intoxicated and he is not steady on his feet. So what nurse will do? She has a order for restraint in place. So let's see what she has to do here. Place the restraint in compliance with the hospital policy. Whether she has to do or not, patient is refusing, and you know the state of the patient. He is intoxicated and he is not steady on his feet. What is concerned here is the safety of the patient is so concerned. So you have to keep in your mind. So here says that place the restraint in compliance with the hospital policy. Second option, refrain from placing restraints to honor the client's wishes because he has the right to refuse care. He has the right to refuse care, but safety is important here. So that one is less important than the refusing. You are not considering refusal at this point because the patient is at the risk of fall or risk of injury. So you have to put patient on restraint. Third is call the physician for advice on how to proceed. So you already have an order from the physician that you don't need how to proceed. This is your judgment. You have to assess in this situation. Fourth option is check on the client every hour to ensure his safety. Not every hour. The patient may fall before that. So it is not every hour. So the thing is that you have order in place for restraint. So put the patient under restraint. So let's see the rationale what is given here. Correct. The nurse should place the restraint in compliance with the hospital policy. This is a circumstance where the client's risk of harm and promotion of safety trumps the client's right to refuse. Okay, so that's it. So the second option, the client is at risk and intoxicated, so the nurse should place the restraints. Third option, see, when you consider, maybe in the real world there is something else happens, but in the scenario, for example, an RN question, when the Nclex question is asked, so they are testing what the exam takers, exam takers how they perform their responsibility before it is transferred to other people. So that is what Nclex is testing. For the nurse at some point may call the physician for further assistance, but the Nclex RN exam wants to know what the test taker would do rather than passing the response to someone else. So that's what is here the difference, because now you are not calling the physician, may consult for further management, but what you have to do something before calling the physician. Option number 4, the nurse could check on the client every hour, but only in addition to the needed ongoing safety measures of restraints or constant observation. A client could fall within minutes. An hour is too long to leave an at-risk client alone. Okay. Question number 9. The nurse is working in an outpatient clinic. The nurse has a client who appears intoxicated and who drove to the appointments. The nurse is concerned about the client's ability to drive home. Which of the following should the nurse do first? So, intoxicated patient came for an appointment. So, he drove to the hospital but returning to him home. So, what things the nurse has to do first? Call the police immediately. Second option, ask the client's permission to call a family member or friend for a ride. Option 3, give the client a ride home to protect his privacy. Fourth is call clinic security to obtain the client to protect his safety. So here you don't have to call police straight away, straight for the first step. No, you don't have to do that. First thing what you have to do is ask the client's permission to call a family member or a friend for a ride. The maybe the patient can tell you, means can give somebody's name as a close relative family member. Yes, you can call so they can take me back. Patient will respond in that way. So you can ask the patient permission whom to call, and that is okay to call them. You can consult with the patient, then you can call them. That is a better option. That will be the one first thing the nurse will be doing. Okay. So give the client a ride home, protect his privacy. No, the nurse is crossing the boundary. That's not crossing the boundary here. So nurse don't have to do that. She can't drive patient home. Okay. Then the second option could be a correct option. Call clinic security to detain the client to protect his safety. That could be done, but first you can ask the patient for getting any of his relatives to hospital for giving him a ride back home. Okay. Question number 10. A mother of a teenage client who has permission to be involved in the plan of care is asking the nurse questions. After it has been explained to her that her child has bipolar disorder, which of the following statement by the mother indicate that further teaching is needed? Means here you feel that the teenager's mother is knowledge deficit. Okay, so because you already mentioned about in further teaching about how to care for this person, like bipolar disorder, child is suffering from bipolar disorder. So you given explanation, and when you listen, when you take the feedback from the mother, you understand that she did not understand the the points discussed with her correctly. So which statement from the mother makes you sure that the mother has a knowledge deficit? Option number 1, my child will be cured after being a medication for a few months. So bipolar disorder usually needs a lifelong treatment and is not curable. So you can remove option number 1. Second is, my child will require support and encouragement. Definitely, a person suffering from bipolar disorder needs support and encouragement, but that is not the priority here. Priority option here. Option number 3, my child will be on psychiatric medication probably for rest of her life. Okay. Then the fourth one is the goal of the medication is to reduce symptoms associated with bipolar disorder and hopefully help with the mood swings. So, mm here, so it is like you are choosing, because rest will be a correct answers. So there is, it's like a negative stem questions because knowledge deficit it comes here. So 10, the rational is correct one is, sorry, the correct one is bipolar disorder is not curable. The first option is the correct because it's a negative stem question. The bipolar disorder is not curable. Clients can suffer from bipolar disorder throughout their entire lives. The mother statement that a child will be cured after being on medication indicate further teaching about the disorder is needed. So you realize that the mother doesn't know much about the disease condition, so she needs more education about bipolar disorder. Rest all correct. Needs support and encouragement, and psycho medication is bipolar disorder usually lifelong, and the goal this one goal of the medication is to reduce symptoms associated with bipolar disorder and lessen mood swings. This is the purpose, the goal of medication. Okay, that's the, we continue. Question number 11. The home care nurse makes a visit to the home of an elderly client who has episodic confusion but who has remained safe at home while occasionally alone. The nurse finds the client disheveled, confused, and agitated, and the home is messy. This degree of confusion is unusual for this client. The nurse takes the client's vital signs, in which the blood pressure is 115 by over 70, heart rate 70, respiratory rate is 16, and temperature is 98.7, 37 degrees centigrade. Which of the following actions should the nurse take first? So here it's an unusual for seeing this man confused. Okay, so that, see, this is something a new finding for this man. So the what the nurse has to do at first, so nothing, because the client vital signs are stable. Option 2, plan to come back the following day to reevaluate the client. Third option, encourage the client to verbalize his or her feelings. Call the client's family to take the client to be evaluated by the physician because the client is not safe to be alone right now. So what option is the correct option is option number 4, because you can't leave a patient like this, because something is a new finding and you can't leave without having any concern about this patient, though the vital signs are stable. Maybe some serious issues going behind this. Vital signs are normal, but you have to call the family to take client to to be evaluated by a physician because the client is not safe to be alone right now. Other things like nothing, no, the nurse should not leave patient like that. Okay, plan should come back to follow. Of course the nurse can go back and evaluate for evaluate the client next day. She can do that. Encouraging the patient to verbalize at this point when the patient is confused and agitated, or this time, that is not the right time to do that. Okay, now question number 12. The nurse is on Alzheimer's unit. A client is agitated and pulling at things. Which of the following should the nurse do? Okay. Option number 1, provide the client with a therapeutic sensory device. Option 2, cohort the client with another client who is agitated because they will calm each other. Option number 3, place the client in a room with several other clients. 4, leave the client alone for a period of time to reduce stimulation. In this condition, the patient, Alzheimer's patient, agitated and pulling things. So we have to calm down this, okay, for this patient. So what we can do is putting the already agitated patient, you can't, because that will accelerate more issues. That is second option is wrong. Third, several other clients, it is more stimulating, and client will be more agitated. And you can't leave a patient or this client for a long time. Leaving a client alone for a period of time to reduce stimulation, this you can't do because he's already has a trigger and he's agitated. So what is it? Provide the client with the therapeutic sensory devices like a painting stuff or some drawings or some play stuff like that you give, and just make that patient comfort means more, bring the patient to more comforting stage. That's what you have to do here. As option first is the correct one. Question number 13. The nurse is caring for a terminally ill client who has agreed to enter hospice care. Which of the following statement by the spouse indicate a need for further teaching by the nurse? So here you will see a knowledge deficit for the spouse, because she is not fully aware about what the hospice care is meant for. Okay, so here when the spouse state a statement, like four statement you are going to see, out of this which one is wrongly understood by the spouse. So first option is, you will help to make my spouse as comfortable as possible while in hospice care. Option 2, yes, that is as much as comfortable, that is the purpose, means that is the thing really happens in hospice care, making the person as her spouse as comfortable as possible. That is one of the target. Second, you will help my spouse get better, we can get back to our old life. That is not the purpose of hospice care. There is no remote chance, some maybe very rarely somebody go back to their life, but hospice means the end of life, and they are just comfort cares only is provided. That is the wrong information the spouse is sharing. That will be the correct option here. Third is, the goal is to make the end of my spouse life as comfortable as possible. That is a correct understanding of hospice care. Then, you will provide me with the support during this difficult time, and that one also a correct understanding of spouse about hospice care. Question number 14. The nurse is caring for a male client. The client has exhibited some signs of anxiety and hostility. The nurse is aware that the client is a recently returned combat veteran. The nurse should assess the client for which of the following conditions. So he is coming from a war zone. So mostly the people from army after the war, when they will be suffering from post-traumatic stress disorder. Okay, so that is the correct option here. Post-traumatic stress disorder, or bipolar disorder, or schizophrenia, borderline personality disorder. And I'm not telling that people won't have all these problems, but a person coming out of returned combat veteran, mostly they will be suffering from PTSD, the post-traumatic stress syndrome disorder. Question number 15. The nurse is caring for a client with a known past medical history for intravenous substance abuse. The client requests to go outside for a few minutes to smoke a cigarette and promise to come right back. The client has a peripheral intravenous line in. The nurse should take which of the following actions? So this patient is a IV drug abuse patient. He has a peripheral line already, and he is requesting to go out for smoking. So what are the actions the nurse can do here? Allow the client to go outside, but set a time limit in which to return. Option 2, call security to escort the client to an approved smoking area. Third, make a behavior contact with the client that includes an agreement to have the nursing assistant to accompany the client outside. Watch the client from the window to make sure the IV line stays open. So here the correct option is make a behavior contract with the client that include an agreement to have the nursing assistant accompanying the client. Okay, So, watching through the window is not a correct approach. Even calling the security patient is humbly asking you. So, you don't need to be accompanied by security. He is not violent or he is not a threatened situation here. And allow the client to go outside but set a time limit. No, he has to be supervised. So, the nursing aide can go with the patient with the make a behavioral contract. Okay, that is the correct option here. For 16. The client is a non English speaking elderly woman who is being admitted to the hospital for worrisome symptoms. She is accompanied by family members who speak English. The nurse admitting the client needs to ask some general admission questions. It would be most appropriate for the nurse to take which of the following actions. So here, a language barrier. The client has a language barrier. So first option is to call the hospital interpreter services to assist with asking the client questions in her native language. Option 2, ask family members the questions and document their responses. Third, ask family members to translate and ask the questions for the nurse. Fourth, the document unable to obtain answers. Patient does not speak English. So here the correct option is you have to call the hospital interpreter services to assist with asking the client questions in her native language. So you are telling the interpreter to ask these questions to the patient, and patient will respond to the interpreter, and interpreter will let you know what the patient said. That means that the patient on words she is giving you. Okay, so interpreter is giving the right sentences was the what the client was shared with the interpreter. So asking the family member question and you document their response. So we never know that what the because you don't know their language. So we don't know what the relative is going to talk to her and whether she is giving the right response of the patient what she said is giving to you. So that is not the correct approach. Then the family member the translation also question for the nurse, that's also not correct approach here. Then unable to obtain, no, you can't just leave like that. Patient is a language issue, language problem, and you are just leaving unable to obtain answers, so you can't leave like that too. Question number 17. The client has a medical history of alcohol abuse and had a drink yesterday. The nurse notes tremors, diaphoresis, and an elevated heart rate. The nurse should perform which of the following action first? The patient is drunkard, alcohol abuse, and had a recent drink, means yesterday had. Nurse, patient is suffering from withdrawal symptoms. So from the notes that tremors there, diaphoresis there, and elevated heart rate and all. These are all withdrawal symptoms. Okay, what the nurse will do at first? Following actions. Okay, call the physician to report the symptoms and administer hydromorphone for alcohol withdrawal pathway. Second option is assess the client every hour to monitor symptoms. Third, call the family and administer meperidine per the alcohol withdrawal pathway. Fourth, administer lorazepam per the alcohol withdrawal pathway. So in 17, so you have to give alcohol withdrawal means the medication for alcohol withdrawal symptom. So benzodiazepines, the fourth option, benzodiazepines such as lorazepam are often given as a part of an alcohol withdrawal pathway. The client is clearly beginning to exhibit symptoms of withdrawal by having tremors, diaphoresis, and elevated heart rate. That is the correct option there. Here, the nurse might call the physician at some point to report unmanageable symptoms, but hydromorphone of pain and not for management of alcohol. So hydromorphone is given for pain, and if unmanageable, for example, in an emergency patient comes and there is a policy, there will be a protocol for how to manage withdrawal symptoms, alcohol withdrawal symptoms. So they have a ready order for that, so they can start with that. The nurses can start with that. So the nurse might assess the client every hour, but it is not the first thing. So nurse has to observe this patient every hour, but that is not the priority here. And meperidine withdrawal symptom is not for withdrawal symptom. It is for pain as well. So the meperidine and giving other things like calling the physician or assessing the patient every hour, these are not the priority here. Giving the patient for alcohol withdrawal symptoms to counteract that one, so you are giving benzodiazepines such as lorazepam. That is the correct option here. 18. The client with a post-traumatic stress disorder (PTSD) appears to be giving a flashback. It would be most appropriate for the nurse to perform which of the following intervention? So this man has come from a war zone, so he has, or any other, means any trauma, any traumatic event happened in his life. So he is suffering from PTSD. So and he is getting a feedback of that. So he is reliving in that scenario. So what the nurse has to do, the most appropriate, okay, first is encourage the client to tell the nurse how the client is feeling in the moment. Second option is calmly reorient the client to the current situation. Third is assist the client in acting out the event. Fourth, tell the client loud that what the client is experiencing is not real. So what you have to, you don't have to encourage the patient, because we have to bring that patient into the reality. He is no more in that situation. So we have to bring him back to the real world, and what we have to do is the option number 2, calmly reorient the client to the current situation. That's what we have to do. Okay, assist the client to acting. No, you don't have to assist or encourage for acting out or getting feedback or all those things, or experiencing, telling the patient you are not, your experience is not real. No, not things. So what, calmly we have to reorient and bring the patient in the correct situation. 19. An elderly client asked the nurse to kill the bugs that are crawling on the floor of her room. The nurse does not see any bugs and suspect that client is hallucinating. Which of the following statement by the nurse would the most appropriate? Here also the patient feel that there is bugs crawling there on the floor. So and the patient is expressing that. So the what is the most appropriate approach here? So the option 1 is, it may seem to you that there are bugs crawling on the floor, but I don't see any bugs. Okay. Second option is, I see them too. How would I kill them? Third is, can you tell me more about these bugs? Fourth, what do the bugs looks like? So what you have, you know that the patient is hallucinating. So hallucination, you don't have to encourage that patient at any sense to taking that patient in the say that's the what the patient think like that it is correct, what it is, there is bugs and there is crawling. No, bugs crawling, no, that's not there. So what you have to tell is making the patient realize that, or tell them that it may seem to that there are bugs on the crawling, but I don't see any bugs on the floor. So that is the correct statement you have to tell the patient, means because he is hallucinating, he is seeing something which is not there. Tell the reality to the patient. Okay. Question number 20. The client has had a depressed mood, decreased sleep, poor concentration, and poor appetite for the past 4 months. Which of the following does the nurse expect physician to prescribe? So he is past 4 months, no appetite, low, no constant, decreased sleep, poor concentration. This guy is suffering from depression, isn't it? So what medication is to be given to this patient? Quetiapine, haloperidol, mirtazapine, clonazepam. So which one is this? The physician will so quetiapine is not typically given for depression symptom. It is usually given to bipolar. So quetiapine is for bipolar disorder. Haloperidol is for depression. For then mirtazapine is typically prescribed for depression. Oh, when haloperidol is for schizophrenia. Sorry, haloperidol is for schizophrenia. So mirtazapine is typically prescribed for depression, and clonazepam is more typically given for panic disorders. So clonazepam is for panic disorder, mirtazapine is for depression, haloperidol is for schizophrenia, and quetiapine is for bipolar disorder. Question number 21. The client is experiencing a manic episode. It would be most appropriate for the nurse to perform which of the following interventions? The patient is energetic, too much energy is there because he has a manic episode. So what are the options? The most appropriate one, okay? First one is give the client material to make a collage. Like collage is cut pieces, clothes and making stuff like that. Kandam vacha photo pole. To encouraging the client to use a exercise bike. Third option is encourage the client to attempt to group about managing feelings. Fourth is ask the client to play a board game with other clients. So this client is at high energy level. So what the action the client can do here is exercise bike, because other things like group work or game with other clients is not ideal at this point, and giving him a different piece of clothes and making something art out of that is not the correct word. So he has lots of energy. He should release his energy by doing exercise on the bike. 22. A client with bipolar disorder makes a sexually inappropriate comment to the nurse. The nurse should take which of the following actions? So first option is ignore the comment because the client has a mental health disorder and cannot help it. Report the second option, report the comment to the nurse manager. Third, ignore the comment but tell the incoming nurse to be aware of the client's propensity to make inappropriate comments. Fourth, tell the client that it is inappropriate for client to speak to any nurse that way. So here, though the patient is suffering from mental disorder, okay, so you have to tell the client that it is inappropriate for a client to speak to any nurse that way. So the option 3 is ignore the comment. No, you don't have to ignore. You never ignore that. You have to tell the patient that you're not supposed to make such comments. Then not reporting to the nurse manager or ignoring the comment, because no, you don't. You have to taken care of that. Okay, what the patient is. If it is an inappropriate sexual comment, something the patient is telling you, you should be taken care of that. You should talk to the patient that it is inappropriate, it is not allowed. 23. Question number 23. The nurse makes a home visit to a child with a G-tube. Upon arrival, the nurse notices that client is sibling is wearing dirty clothes that are too small. The nurse also notices that there is no food in the refrigerator or in the kitchen cabinets. Which of the following most appropriate to describe how the nurse should respond to this observation? So a nurse is in a house, and for a G2 feeding she came. She say the fridge is empty and her sibling is with the dirty clothes on. So what comes in first in your mind is maybe these children are neglected. Okay, so just keep that in mind, but not what most appropriate. Before that, you should inquire about what is the situation is correctly. Yeah, maybe their parents are on the way to buy food, Maybe the child is coming from playground and that's why it's dirty. So first you should do a good enquiry about that. The nurse should, this, the option 1 is the nurse should not be concerned because the sibling is not her client and the client is being fed through G-tube appropriately. So you can't ignore because you are the first responder for many cases. If something is there, it is your responsibility. It is nursing responsibility to report something abuse or neglect. Neglect also is a form of abuse. You have to report. So always keep your mind alert and attentive. If something is there, you are responsible for that. Option 2, the nurse should not be concerned because there is no sign of physical abuse. Whether there is a sign of physical abuse is there is evidence there or not, but neglect also a form of abuse. Option 3, the nurse should be concerned and take action because there is no food or appropriate clothing available to the sibling. The fourth option is the nurse should not be concerned because her client is well cared for. So her client well cared doesn't mean that she should not care about the sibling of that child. Okay, so the option 3 is correct. The nurse should be concerned and take actions because there is no food or appropriate clothing available to the sibling. So first inquire why. Maybe he is coming from playground, that's why it is dirty. Or just ask them where the parents and did they go for shopping for buying food. So ask first. If there is evidence or the children says that no, they don't have food or they don't have clothing enough, that will be the time you will report, okay, and that to be taken care. Question number 24. The nurse is caring for a hospice client who lives at home with an attentive spouse. The client's spouse quit work to care for the client. During the nurse visit, the spouse expresses frustration and hostility towards the nurse. Which of the following are appropriate intervention by the nurse? So hospice client is leave, they decide to leave at home. Then attentive is when the spouse is taking care, and the client, the spouse quit her job for caring her spouse. During the nurse visit, the spouse expresses frustration and hostility towards the nurse, and she is frustrated. She is getting angry with the nurse. So what intervention? Which of the following are appropriate intervention by the nurse? So select all that applies. It's a SATA question. The nurse should encourage the spouse to verbalize feelings. 2 is the nurse should encourage the spouse to attend a caregiver support group. Third, the nurse should encourage the spouse to go back to work part-time. Fourth, nurse should encourage the spouse not to verbalize negative feelings that may upset the client. Let's go and see what 24 says. There are two correct options here. First is verbalizing feeling is an appropriate intervention for family members suffering from caregiver role strain. So this lady is already, the spouse is already tired and she tired of giving care to this hospice husband who is in the hospice stage, means a dying husband. The second one is attending a support group is an appropriate intervention for family members suffering from caregiving role strain. So they maybe like her, there are other people in the community suffering from the same thing. When they share their feelings, when they maybe somewhat it may be helpful for them to share their feelings and getting some points how they are managing or those things, that is helpful. That is also a correct approach. So the third option, it may not be possible or practical for the spouse to go back to work part-time. So maybe because she can't leave her husband who is really in dependency and the hospice, anytime he may die. So it may not be possible for resuming the spouse her work, okay. And the fourth one, encouraging the spouse not to verbalize negative feeling, interfere with the natural expression and personal family conversation. Encouraging the spouse not to verbalize negative feeling, interfere with the natural expression and personal family conversation. So whether it's a negative or positive, they should express the feeling, they should share what is there. 25. Question number 24. The nurse is taking a history from a client in an outpatient clinic. The client has been taking lorazepam for 6 months. Which of the following is the most likely side effect that the nurse would expect to see as a result of the client using Ativan for this time period? So 6 months. The client is taking lorazepam for 6 months. Okay. So the thing, excessive appetite, physical dependency, suicidal ideation, or seizure activity. The correct option here is physical dependency is the correct option here. Let us see how this rationale is given. 25. Excessive appetite is a possibility, but not the most likely, because the question is asked most likely. So excessive appetite could happen, but most likely what can happen is physical dependency. Clients can experience all type of side effects from benzodiazepines, but the most likely side effect from prolonged use of physical dependency. Suicidal ideation is a possibility, but that is not the most likely. And the same thing, seizure activity is a withdrawal effect. The nurse would monitor for if the client discontinued lorazepam. If the patient discontinued lorazepam abruptly, the patient may have seizure activities. That's a withdrawal effect. So 26. The client requires life-saving blood transfusion per hospital guidelines. The client refuses. Based on religious beliefs. It would be most appropriate for the nurse to take which of the following actions? Again, the question is most appropriate. So the patient is refusing, because of the religious beliefs, she is not going to take blood transfusion. It's a life saving. So first option is confirm with the client that the client understands the potential risk of not having the blood transfusion. Option 2, tell the client that regardless of personal beliefs, the client has to have the life saving transfusion. Third, call the legal department of the hospital immediately. Fourth is try to gently encourage the client to change his or her mind. The correct option here is option number 1, confirm. First, you have to confirm with the client that the client understands the potential risk not having blood transfusion. So you have a discussion with that patient and make sure that she understands the risk of not having blood transfusion. That is the correct option here. Nurse must sure the client understand the potential risk or not receiving transfusion. The second option, the client do not have right to refuse care on religious client do have the right to refuse based on their religious beliefs or grounds. Now, although a nurse call the legal department at some future time, this would not be the first. You have to talk to the patient and explain to them the risk of not having transfusion. Then further step you can do, maybe that is later on, but that is not the most appropriate. Fourth one, the nurse must be sure that the client comprehend the choice he or she is making, including risk and benefit. However, the nurse does not want to coerce the clients into changing his or her mind. So you don't have to force the patient for changing her mind or her decision, but you tell the stand, means what are the risks, what are the benefits. You have to make the patient just make sure that patient understand what you are talking to her. Question number 27. The nurse monitors client's medication in a day program for client with disabilities. The nurse notices a teenage client who is frequently alone and often quiet. It would be most appropriate for the nurse to take which of the following? Allow the client alone time, since the client seems to prefer this. The client has the right to make that choice. Option 2, make an effort to interact with the client periodically. Third, encourage the client to join a youth group. Fourth is encourage the other client in the program to interact more frequently with the client. So the correct option here is encourage the client to join a youth group because that will help to this teenager to develop his social skills, social interactions. Okay, 27. Let's see the rational what it says. It appears that the first option, it appears that the client has enough alone time, which would stunt the client's social growth. So, may the retardation it can cause living alone and there is no social interaction. So that may cause retarded growth in this child. It should also defeat the purpose of daycare. There is a program is in situ. That's a daycare program. That's one of the goal of daycare program is making their life better, which is to promote interaction among clients. So one of the goal of the daycare program is because the nurse is coming and visiting this teenager every day, and their goal is to promote interaction among clients. So she has to encourage this child to have contact with the youth group. Okay, so the correct option is participating in a youth group can help teenage client with a disability develop social skills, use a support system, and feel more like a typical teenager. So though he has disabilities, but getting involved with the group, okay, he can develop social skills, he can get supports from the system, and he feel more like any other child in the society. So option 4 is wrong. Why? It would not be appropriate to talk about one client with other. So if you are going and discussing about this client in the group, that is not appropriate because the reason confidentiality and privacy. You have to maintain confidentiality and privacy of this client. So for the next second option for this one is why making an effort to interact with the client periodically does not lead to the client's personal growth. Therefore, it is not the best option. So nurse going every day and making an interaction with the client doesn't make develop a personal development for this child. Okay, so because that is less beneficial than promoting or encouraging him to join in the youth group and getting interacted with the other same group of people, the teenagers. Question number 28. The nurse on the inpatient psychiatric ward is caring for a client with a non-suicidal ideation. The 24 hours observer calls the nurse to report that the client took off down the hall. The nurse is unable to immediately locate the client. Arrange the following actions by the nurse in the order that most appropriate. All options must be used. So it is there are 4 options, all are correct, but we have to put them in order. So the patient is run away from the inpatient unit. So took off down to the hall. So the caretaker, 24 hours caretaker, she knows that the direction where the patient ran. So that is, so first option here, notify the security that the client has elapsed and provide a description of the client. Option 2, notify the nurse manager. Third is notify other staff on the unit. Fourth is ask the observer in which direction the client headed. Okay, first that observer is reporting you. First you have to ask what, which direction the patient is. So ask that the fourth option is the first. Okay, ask the observer in which direction the client headed. So you got the direction and you have information that patient went out of the unit. So first option is that. Second is notify other staff on the unit. That is means they are immediately available. No? So tell them that this patient get out from the unit. So tell them that which direction they went. Then you are calling the security and give about it. Notify security that the client has elapsed, absconded or run away from the unit, and provide a description of the client and tell this is a fair guy, tall, this like whatever the physical appearance or what dress he is on, all those things. Then the last step is notify the nurse manager. So first is ask the observer in what direction the client headed. Second is notify other staff on the unit. Third is notify security that the client has elapsed and provide description of the client. Fourth is notify the nurse manager. 29. The nurse discovers a hospice client has expired. The family members are regrouping in the facility's waiting room. Which of the following action by the nurse would be the most appropriate? The patient died in hospice care center. Patient died. So family is there and they are in the waiting room. So here, option one, most appropriate here, nurse. Okay, tell the family it would not be in their best interest to see their loved ones. It's not the nurse's responsibility to say that, and what is their interest, they will be the one deciding. So that option is absolutely no. Encourage the family to view the body to help accept the situation. So it's, you are not encouraging them. Okay, so encourage the family to view the body and accept the situation. It is totally for them how to do it. Okay, then the third option is provide condolences to the family and offer them viewing time. That is what the nurse has to do. So just empathize with the family for their loss, then offer them viewing time and tell them to come and see this one. Then rest of things they can discuss among, then let the facility know what they want to do ahead. The fourth option is tell the family, I will give you some time to spend with your loved ones. Let me know if you need anything. That's not the correct. You don't have to tell the family. First you have to empathize with them, give them time, then rest thing they will let you know. Okay. So that was 29. 30 is a nurse is caring for a newly admitted in a hospital setting. The client was recently diagnosed with cancer but is alert and oriented. The client is a Greek immigrant but does speak English. During the admission process, the nurse inquires about advance directives with the client. The client tells the nurse, I do not want to make any medical decision. I want my daughter to make these decisions for me. The nurse should take which of the following actions? The advance directive is the what the patient want to do when she become unconscious or unable to make any decision. That is a decision that is advance directive, what is to be done, what is not to be done for that patient. Okay, that's what it's mentioned in the advance directive. The patient says, no, I don't want to make any medical decision, I want my daughter to come and make decisions. So here the nurse should take which of the following actions here. First is make sure that the written advance directive document the patient's wishes. Second, tell the client that being alert and oriented, the client should make his or her own medical decisions. Third, tell the client that due to confidentiality, the daughter will not be informed of details of the client's care. Third, encourage both the daughter and the client to work together on making medical decisions. So here the option correct is for option, first option, sorry. As long as the client is not persuaded into this decision and the nurse believe that it is being made of the client's free will, it is acceptable for the daughter to take over medical decisions making for the ill parent. Okay, that is the correct option here. The second way it's wrong. The client is entitled to have her daughter make the medical decisions for the client if that is what the client wishes to do. The third option is client entitled to allow her daughter to be informed of the details of the client's care. Fourth is the client is entitled to have her daughter make the medical decision for the client and the nurse should not encourage her to do otherwise. So you are not encouraging anything, you are not encouraging, and as a nurse you are not encouraging, you should come there on. Okay, so the first option is correct. Okay, hope you had some information from these questions. Thank you for watching.